continue with this chapter of hypoxia. Last time we explained the first type of hypoxia, which is called, anyone remembers? Hypotonic hypoxia. We also call it hypoxic hypoxia. And the second type we're going to explain is hemic hypoxia, something wrong with the blood. And the cells of the tissue suffer from short or lack of oxygen. Hemic hypoxia refers to the altered affinity of hemoglobin for oxygen or decreased in amount of hemoglobin in the blood. The reason of hemic hypoxia are mainly these two: anemia, we call it anemic hypoxia, and carbon monoxide poisoning. And carbon monoxide poisoning. In carbon monoxide, it can react with hemoglobin to form carboxy hemoglobin. This hemoglobin is the combination of carbon monoxide and hemoglobin. Once the sites on the hemoglobin is taken by carbon dioxide, it cannot carry oxygen anymore. So there is a deficiency of hemoglobin that can carry oxygen. And carbon dioxide can also inhibit glycolysis in RBC, which reduces the production of 2,3-DPG and shifts the ODC to the left. What is ODC? At the beginning of last video, I introduced the oxygen hemoglobin dissociation curve, which is ODC, to the left, decreasing the amount of oxygen released. When it moves to the left, the oxygen and hemoglobin can bond very firmly and difficult to separate. So the oxygen won't be released. Once it's moved to the right side, it means it's difficult for the oxygen to combine with hemoglobin, where in the capillaries of lungs, the oxygen cannot be taken by hemoglobin as a variable. No need to mention at the terminal, which is the tissue end, how many oxygen will be transported to where it's supposed to go. The characteristics of blood oxygen of hemic hemoglobin is partial pressure of oxygen is normal, and saturation of oxygen is normal, and the capacity of oxygen is less normal or normal, and the content of oxygen is less, because we don't have enough quality or quantity of HB or hemoglobin to take oxygens in the blood flow. And the difference between arterial and venous end, the content will be dropped because there is not enough to be taken to the tissue, so less can be used. Color of skin. For anemia, we are very familiar. Everyone knows anemic patients look pale, so they have pale skin color. And hemoglobin that combined with dioxide or carbon C hemoglobin. Its classic cherry red skin is very rare, even though the classic color is supposed to be cherry red. That's why there is a saying, when you're cherry red, you're dead. Because of, yes, carbon monoxide poisoning.